atrial fibrillation on dabigatran presents with acute stroke and requires emergency thrombolysis. Which step is most critical before administering alteplase? A. Administer vitamin K. B. Measure thrombin time TT or eccrine clotting time, ECT. C. Switch to warfarin immediately. D. Administer protamine sulfate. Answer B. Explanation. Dabigatran prolongs thrombin time, must confirm anticoagulant effect before thrombolysis. Q2. A 55-year-old patient with epilepsy controlled on valproate is started on carbapenem antibiotic, imipenem. Within 3 days, he develops seizures. What explains this? A. Carbapenems increase valproate absorption. B. Carbapenems decrease serum valproate levels. C. Carbapenems displace valproate from albumin. D. Synergistic CNS toxicity. Answer B. Explanation. Carbapenems lower valproate concentration by increasing glucuronidation, breakthrough seizures. Number 2. Hospital pharmacy Q3. A hospital finds that cisplatin infusions were prepared in normal saline, while one batch was prepared in dextrose 5%. What is the likely consequence of the dextrose batch? A. Increased stability. B. Drug precipitation and inactivation. C. Enhanced cytotoxicity. D. Safer infusion. Answer B. Explanation. Cisplatin is incompatible with dextrose degradation precipitation. Q4. A patient in ICU receives IV amphotericin B. After infusion, he develops fever, chills, and hypotension. Which is the best preventive measure? A. Administer antihistamine plus corticosteroid premedication. B. Switch to ketoconazole. C. Infuse rapidly over 30 minutes. D. Add potassium supplement before infusion. Answer A. Explanation. Amphotericin B infusion reactions prevented with premedication, antihistamines, steroids. Hanger 3. Community pharmacy Q5. A patient on cyclosporin asks for OTC St. John's wort. What is the major risk? A. Increased nephrotoxicity. B. Reduced cyclosporin levels, organ rejection. C. Severe hyperkalemia. D. Hypertension. Answer B. Explanation. St. John's wort induces CYP3A4, reduces cyclosporin, transplant rejection. Q6. A young man with history of G6PD deficiency requests OTC primaquine for malaria prophylaxis. Why should the pharmacist refuse? A. Risk of hemolytic anemia. B. Risk of lactic acidosis. C. Risk of nephrotoxicity. D. Risk of optic neuritis. Answer. A. Explanation. Primaquine causes severe hemolysis in G6PD deficient patients. Number 4. Pharmacotherapeutics. Q7. A cancer patient develops cardiotoxicity after multiple cycles of doxorubicin. Which preventive agent should have been given with cumulative doses? A. Dexrazoxane. B. Mesna. C. Leucovorin. D. Filgrastim. Explanation. Dexrazoxane chelates iron, reduces anthracycline-induced free radical cardiotoxicity. Q8. A hypertensive patient is treated with clonidine. He suddenly stops the drug and presents with severe rebound hypertension. What is the mechanism? A. Downregulation of ABR2 receptors. B. Upregulation of adrenergic receptors, increased sympathetic outflow. C. Increased dopamine release. D. Impaired vagal tone. Answer B. Explanation. Chronic clonidine use suppresses sympathetic outflow, abrupt withdrawal, rebound hypertension. Number 5. Regulatory guidelines. Q9. A generic manufacturer applies for biosimilar approval of a monoclonal antibody. Which requirement is unique to biosimilars, not for ANDA generics? A. Clinical trial evidence of efficacy and safety. Demonstration of identical excipients. C. Bioequivalence based only on Cmax and AUC. D. Waiver of toxicology studies. Answer A. Explanation. Biosimilars require clinical comparability studies. Generics rely only on PK bioequivalence. Q10. A new oncology drug in phase 3 trials shows superior efficacy but increased risk of fatal arrhythmias. Regulatory authorities decide to approve it with REMS, risk evaluation and mitigation strategy. Which of the following is most likely included? A. ECG monitoring and prescriber training program. B. Waiver of safety reporting. C. Substitution with placebo. D. Bioequivalence study only. Answer. Explanation. REMS mandates risk mitigation steps, monitoring, restricted distribution, prescriber certification.